Hi, my name is Lexi Furphy, and the policy brief and public health issue that I chose to focus on is the opioid epidemic, which is currently a major issue in the United States today. So the main areas of focus for this policy brief are education, treatment, prevention, and impacts of the opioid epidemic. So starting with education, it's really important that people learn the signs of an opioid overdose and they learn what to do in this situation. And this is particularly important for healthcare providers, so they really need to stay up to date on their continuing education in order to know what to do in these situations. So in terms of treatment for those who are addicted to opioid analgesics, there's either inpatient or outpatient programs, and it's really important to support these programs in terms of funds and just making sure that it's allocated to the right places, and so that these treatment programs are able to function at their full capacity. And so another component of prevention for opioid overdoses is to encourage everyone to call 911 if they're experiencing or witnessing an overdose. So several states have enacted Good Samaritan statutes, which protect those calling in an emergency situation from any arrest, charges, or prosecution. So removing this fear factor of calling 911 will save thousands of lives, and supporting measures such as the Good Samaritan statute is the best way to educate, support, and protect those who are affected by an opioid overdose. So what are some of the implications of the opioid issue? In the relation to the opioid crisis, there's no question that action needs to be taken. This is a public health emergency. Lengthy strides need to be made in order to address the opioid crisis. So implementing policies and actions to promote awareness, education, treatment, and prevention, as well as addressing the current discrimination and bias against those who suffer from addiction, will be critical in addressing this national public health issue. Thanks.